Today we're doing a breast reduction surgery for a patient with a ruptured right saline implant. A few of the points that patients always want to ask and discuss is, number one, if they actually need another set of implants. A lot of patients, once they have issues with implants, they have the thought of not having implants again. And the options in those cases are to either exchange the ruptured implants for new implants, also combining that same procedure with doing a lift. And those are some of the biggest decisions that patients have to do. Number one, if they want implants again. Number two, they need a lift. And a few of the other things that have to be done in revision surgery. In my patients, I like to do periaxillary liposuction because I feel it gives a much better shape. A lot of the time we have to take a capsule out. A lot of the time we have to repair the capsule on the side so that the implants don't go too lateral. In some cases I have to use Galliform 3D, which is our internal bra to support the breast. And in some patients you have to use fat grafting as well. So there's a lot of little things that have to be discussed with the patient when it's revision surgery, and a lot of things that have to be done in the operating room to try to achieve more symmetry on revision breast surgery.